Welcome to another parenting tutorial. Well, a fever is your baby's way of fighting off infections. When your baby has a fever, it can be a worrying time for any parent. However, it's important to understand that a fever is actually a sign that your baby's body is working hard to fight off whatever is causing the illness. It's a normal, healthy response. Essentially, the body raises its temperature to create an environment that's less hospitable to those nasty germs. This increase in temperature makes it more difficult for bacteria and viruses to survive and multiply. So, while it might be distressing to see your little one uncomfortable, it's actually a good sign that their immune system is doing its job. For babies 3 months and younger, a rectal temperature of 100.4 degrees Fahrenheit or higher is considered a fever. This is because younger infants have a less developed immune system and are more vulnerable to infections. It's crucial to monitor their temperature closely and seek medical attention if it reaches this level. For babies older than 3 months, a rectal, ear, or temporal artery temperature of 100.4 degrees Fahrenheit or higher, or an armpit temperature of 99 degrees Fahrenheit or higher, is considered a fever. As babies grow, their immune systems become more robust, but it's still important to keep an eye on their temperature and overall health. Fever itself is rarely dangerous, but it's important to monitor your baby closely and seek medical advice when needed. If your baby seems unusually irritable, lethargic, or has other symptoms like a rash, difficulty breathing, or persistent vomiting, it's best to consult a healthcare professional. They can provide guidance on whether further medical intervention is necessary. Remember, a little knowledge goes a long way in keeping your little one healthy and happy. Educating yourself about common childhood illnesses and their symptoms can help you feel more confident in managing your baby's health. Don't hesitate to reach out to your pediatrician with any concerns or questions. They are there to support you and ensure your baby gets the best care possible. By staying informed and vigilant, you can help your baby navigate through these early years with greater ease and peace of mind. Let's delve into fever myths, separating fact from fiction. First, fever itself doesn't cause brain damage. High fevers, if untreated, can lead to complications, but a simple fever won't harm your baby's brain. Second, not all fevers require medication. If your baby is comfortable and otherwise healthy, you can often manage a low-grade fever with home care. Finally, teething doesn't always cause a fever. While some babies might experience a slight increase in temperature during teething, a high fever is more likely due to an underlying illness. Temperature check. Finding the right number is crucial. As a parent, ensuring your baby's health and well-being is a top priority, and one of the most fundamental aspects of this is accurately monitoring their temperature. Accurately measuring your baby's temperature is key. It helps you determine if they have a fever, which can be a sign of an underlying infection or illness. Knowing the right method and tools to use can make all the difference. Rectal temperatures are the most accurate for infants under 3 months old. This method provides the most reliable reading because it measures the core body temperature. It's important to be gentle and precise to ensure the comfort and safety of your baby. For older babies, you can use a digital thermometer in the rectum, ear, or armpit, or a temporal artery thermometer on the forehead. Each method has its own advantages and can be used depending on the situation and the baby's comfort level. Always follow the manufacturer's instructions for your specific thermometer. Different thermometers have different guidelines, and adhering to these ensures you get the most accurate reading. It's also crucial to regularly check the thermometer's battery and cleanliness. When taking a rectal temperature, lubricate the tip and insert it gently no more than ½ inch. This minimizes discomfort and reduces the risk of injury. Hold the thermometer in place until it beeps, indicating that the reading is complete. For an armpit temperature, make sure the tip is touching skin and hold the arm snugly against the body. This method is less invasive and can be more comfortable for older babies, though it may not be as accurate as rectal or ear measurements. Ear thermometers are another option for older babies and toddlers. They are quick and easy to use, but it's important to ensure the ear canal is clear of wax for an accurate reading. Gently pull the ear back and up to straighten the ear canal before inserting the thermometer. After each use, clean the thermometer according to the manufacturer's instructions. This helps prevent the spread of germs and ensures the device remains in good working condition. Use alcohol wipes or a soft cloth with mild soap and water. Comfort your baby after taking their temperature. A gentle touch and soothing words can help ease any discomfort or anxiety they may feel. Remember, your calm demeanor can make the process smoother for both you and your baby. Keep a record of your baby's temperature readings in a health journal. This can be helpful for tracking patterns and sharing information with your pediatrician. Note the time, method used, and any other relevant symptoms. Consult your pediatrician if you have any concerns about your baby's temperature. They can provide guidance on when to seek medical attention and how to manage fevers at home. Trust your instincts and don't hesitate to reach out for professional advice. Store the thermometer in its case to protect it from damage and keep it clean. Having a reliable thermometer on hand is an essential part of your baby care toolkit. Regularly check its condition and replace it if necessary. By finding the right number and using the correct methods, you can ensure your baby's health and well-being. Accurate temperature checks are a small but vital part of caring for your little one, giving you peace of mind and helping you respond promptly to any health concerns. Thermometer tactics: digital, ear, or forehead. Digital thermometers are generally considered the most accurate and reliable. They come in various forms, including rectal, oral, and axillary armpit thermometers. Ear thermometers, or tympanic thermometers, can be quick and easy to use, but can be less accurate if not inserted properly. Temporal artery thermometers, which scan the forehead, are becoming increasingly popular due to their convenience and non-invasive nature. However, like ear thermometers, their accuracy can be affected by factors like sweat or incorrect positioning. While fever is usually harmless, certain situations warrant medical attention. For babies younger than 3 months with any fever, it's crucial to contact your doctor immediately. This is because their immune systems are still developing, and even a mild fever can be a sign of a serious infection. For older babies, seek medical advice if the fever is above 104 degrees Fahrenheit, 40 degrees Celsius, or lasts longer than 72 hours. High fevers can be alarming and may indicate an underlying issue that needs to be addressed. Additionally, if your child has a fever that comes and goes over several days, it's worth consulting your healthcare provider. Other warning signs include lethargy, poor feeding, unusual irritability, and difficulty waking up. These symptoms can be indicators of more serious conditions that require prompt medical attention. Difficulty breathing is another red flag. If your baby is struggling to breathe, has rapid breathing, or you notice a bluish tint to their lips or face, seek emergency care immediately. A stiff neck can be a sign of meningitis, a serious infection that needs urgent treatment. Seizures, especially if they are a new occurrence, should also be evaluated by a doctor right away. A rash that doesn't fade when you press on it, or one that is accompanied by a fever, can be a sign of a serious infection. Trust your instincts. If something doesn't feel right, don't hesitate to reach out to your child's healthcare provider. It's always better to be cautious and get professional advice. Remember, you know your child best. If they are not acting like themselves, or if you are worried for any reason, it's important to seek medical help. Your pediatrician is there to support you and your child's health, so never feel like you are overreacting by calling them. Early intervention can make a significant difference in your child's recovery and overall well-being. Managing a fever at home involves keeping your baby comfortable and hydrated. Dress them lightly and maintain a comfortable room temperature. Encourage fluids like breast milk or formula. For babies over 6 months old, you can offer small amounts of water in addition to their regular feeds. If your doctor has given the okay, you can use infant acetaminophen or ibuprofen to help reduce your baby's fever and make them more comfortable. When your baby has a fever, comfort is just as important as treating the fever itself. Cuddles, gentle rocking, and soft singing can work wonders in calming a fussy baby. A lukewarm bath can also help bring down the temperature. Never use cold water or rubbing alcohol, as this can cause shivering and actually increase the body temperature. As a parent, you know your baby best. You are their advocate and their source of comfort. Trust your instincts. If you're ever unsure about your baby's health or have any concerns, don't hesitate to seek medical advice. Remember, asking for help is a sign of strength, not weakness. Your pediatrician is there to support you and your baby every step of the way. It's important to remember that fever, in most cases, is a positive sign that your baby's immune system is working as it should. Each time your baby encounters a new germ, their immune system develops antibodies to fight it off in the future. While it's never fun to see your little one under the weather, try to view fever as a sign of their growing immunity and resilience. Navigating parenthood is a journey full of ups and downs. Arming yourself with knowledge and reliable resources can make all the difference. Websites like the American Academy of Pediatrics, AAP, and the Centers for Disease Control and Prevention, CDC, offer a wealth of information on infant health and development. Your pediatrician is also an invaluable resource, so don't hesitate to ask questions and seek guidance. Remember, you're not alone on this parenting adventure.